Yes, thank you. For those of you who don't know, VivoSense provides agile end-to-end solutions for wearable and remote monitoring technology in partnership with decentralized clinical trial platforms. So today I'm going to talk to you about how wearable and remote technology can really bring your decentralized trial to the next level. And I think we're all familiar with these types of technologies and have seen headlines like those depicted on the screens. The reality is that wearable and remote monitoring technologies are already being used in clinical trials and healthcare settings pretty broadly and have increased over the last decade. These types of technologies are really perfectly suited to be implemented in decentralized clinical trials for two major reasons. The first is that they can help you do what you're already doing very efficiently and can enhance decentralized clinical trials by measuring how patients feel and function in their real-world environment. So today I'm going to focus on these two areas, and we'll start by talking about how we can streamline episodic measures like vital signs using connected devices. And the last portion of my talk will focus on enhancing clinical trials and how these devices can first provide real-world clinical outcome measures and endpoints, and second, create contextually rich data sets by thoughtful visualizations and the integration of continuous objective sensor data with subjective patient-reported outcomes. We've heard it many times throughout today that one of the biggest barriers for patients participating in clinical trials are for time constraints. Connected devices like Bluetooth-enabled blood pressure monitors and scales and thermometers offer ways to increase the efficiency of taking routine vital signs. You can provide patients with these devices and instruct them to take, say, their blood pressure with a push notification to their phone. They can take that blood pressure, and that data is automatically transmitted back to the study site. This is really advantageous in the context of decentralized clinical trials because you potentially eliminate the need to send study personnel to a participant's home to take these measurements. And if you still need to send them to their home, it certainly shortens the visit. And I think when we consider today's climate in the light of the pandemic, patients may actually feel pretty hesitant to have people entering their homes who are not in their inner circle. And so these devices offer a way to overcome that potential obstacle. Collectively, you allow patients to manage part of this trial and data collection process and reduce trial costs and free up some resources to expand recruitment reach and increase diversity, which we've seen examples of throughout today's presentations. Physical function and performance are relevant outcomes to virtually every clinical population. For these reasons, are often used as primary outcomes in clinical trials. The 6-minute walk test is one of the most frequently performed assessments of physical function and performance. If you're not familiar, this test involves patients walking around 2 cones down a hallway, usually in a clinic setting, and patients are asked to walk for as fast as they can for 6 minutes. The 6-minute walk test is measured episodically, generally at the beginning and the end of an intervention. And the outcome, which is the distance that they can walk over a 6-minute period, is reflective of their maximal physical capacity or what they're totally able to do. Now, when we think about how this test is performed and how does it translate to a real-world setting? And what I mean by that is, what does walking around 2 cones as fast as you can with someone timing you tell us about how a patient actually can function in their own real world? Wearable actigraphy sensors allow us to measure real-world behaviors for weeks to months and even years at a time. These devices can be used to derive real-world clinical outcome measures. And at VivoSense, we've developed what we call a measure, a best 6-minute effort, or B6ME. B6ME is a real-world free-living measure whose concept is based on the 6-minute walk test. So instead of asking patients to walk for 6 minutes as fast as they can, we look on a daily level for the 6-minute time frame that patients exerted their best effort or their maximum effort as a way to capture function in the real world and understand what is the most that a person can do when they are interacting with their own environment. By deriving measures of real-world behavior using these devices to do so, we can track their changes in function over very long periods of time and capture the variability that occurs day to day as well, which can be very powerful. These types of devices also allow us to visualize patient behavior in new ways. So this figure that I'm showing you here are 7 days of data from one patient who wore a device called the ActivePal. Now, the ActivePal is an actigraphy sensor that is worn on the top of the thigh and measures time in different behaviors as shown by 4 different colors here. In blue, we have time spent lying, yellow, time spent sitting, green is time standing, and red is stepping. And by looking at the data in this way, we can start to look at long-term behavioral patterns. So when you look at this spiral, we start at the top, and each concentric circle represents a different day beginning and ending at midnight. What we can see just by looking at the colors is that in this participant, there is a very pronounced pattern of movement and behaviors in the morning time, which occurs most days of the week. And these patterns, when you extend these monitoring periods for very long time intervals, become even more apparent. So these are data from one patient who wore the same device over a 1-year period. And you can really see some distinct bands of color, which indicate different behavioral patterns. And by looking at the data this way, we can start to classify different physical behavior phenotypes and think about advancing personalized medicine by understanding how different patient behaviors and patterns of behavior interact with different therapies and how we can optimize therapy based on patient behavior in the real-world environments. The last area I'm going to focus on is creating contextually rich data by integrating continuous sensor data with patient-reported outcomes. So this example is best demonstrated by a continuous glucose monitor. Continuous glucose monitors assess glucose levels for many days at a time. And what I'm showing you here is patterns of glucose over just 1 day in VivoSense software. For those of you familiar with glucose monitor data, we expect to see fluctuations in glucose over the course of a day, and these often correspond with meals. But there are lots of other behaviors and factors that can change a person's glucose levels. For example, whether they took medication to lower their glucose levels like insulin or sleep-wake cycles. So interpreting these glucose data is very challenging without additional context of what the patient is doing behaviorally. But we can integrate patient-reported outcomes such as the time that they report that they're awake or asleep, or when they take in a meal or take their insulin or even exercise and perform other physical behaviors to gain a more contextually rich and relevant understanding of how the factors that are driving changes in glucose or really any other physiological signal measured by an objective sensor. To wrap it up, I think that decentralized clinical trials are making huge steps forward to reduce the burdens of patients participating in clinical trials. And as we move forward, we'll continue to look for ways to further reduce those burdens. I think that adding wearable and remote monitoring technologies are going to become a staple in decentralized trials as we do just that. It's going to be important to continue to build our analytical and clinical validity evidence of real-world digital clinical measures, but there is extreme value in deploying these outcomes as exploratory and secondary outcomes in early phase trials today. But at the end of the day, it's all about the patient, and we can all agree that we want to provide therapies that are effective and improve patient lives in meaningful ways. And I think wearable and remote monitoring technologies will help us accomplish that objective. Thank you very much.